About 3 minutes, we're gonna get started. You okay? Okay. And we can start moving them back in. All right, we're going ahead and get started. So let's get ready again for our lunch program. We're going to bring up our moderator for this program for our lunch program, Advancing Environmental Opportunities and Cleaning the Air for Lung Health in Louisiana and Beyond. Our moderator for this part of our lunch program. We kind of close the doors until we get them in too, so we get started on time. It's Ms. Natasha G. Nanette. She's a PhD, Assistant Professor of Medicine at the University of Louisville School of Medicine in Louisville, Kentucky. She's going to take us through this part of our lunch program for this particular session. Give her a hand as she comes this afternoon, please.
Well, thank you for the kind introduction and welcome everyone to Advancing Environmental Opportunities. We have talked about so many important pressing concerns, and there's so many that weigh heavily on us. I know that we are amongst a crowd of friends, so I probably don't have to justify this, but there may be somebody that's saying, why are we talking about the environment? Why should we care about the environment? And I'll give you two reasons. One, because when it comes to our health, it's all connected. And two, because what we breathe matters, especially when it comes to our lungs. So I believe we can all agree that we all deserve clean air to breathe, safe water to drink, and environments that are free of toxic hazards, no matter where we live. However, that's not evenly distributed across our nation. But we need it because what we breathe is largely determined by where we live. And what we also know is that where we live is often not a matter of choice. And thereby what we're exposed to is not a matter of choice. Consider redlining and policies like redlining. Those ended over 50 years ago, yet still today, there are systems of underinvestment and overburdening, particularly when it comes to air pollution, that continues to affect formerly redlined communities. Still today, formerly redlined communities have higher air pollution, they have lower tree cover, and they are hotter. They have higher summertime, nighttime temperatures. All of this in combination affects our respiratory health. So in this panel, we're going to talk about some of the burdens that our communities experience, but we're also going to talk about some of the opportunities. We're going to discuss some actions that are taking place in communities that are working to improve public health and reduce environmental burdens. And we have an amazing panel to lead us in this discussion. We have a father-daughter team of community activists, and we also have expertise from the pharmaceutical industry. AstraZeneca is a part of our panel, who is a sponsor of this meeting and a powerful partner with the HEAL Collaborative. And so I'll introduce myself first, and then we're going to go down the line and do some brief introductions across the board. So I am Dr. Natasha D. Jarnett. I'm an assistant professor of environmental medicine at University of Louisville, Christina Lee Brown Envirom Institute, and I'm also faculty at the George Washington University. In addition, most recently, I was Deputy Director for Environmental Justice Data and Evaluation at the White House Council on Environmental Quality under the Biden-Harris administration, and together we work to advance our nation's most ambitious environmental justice agenda. And with that, I am proud to pass the baton to Tish.
Hi, I'm Tish Taylor. I'm the Program Director of Concerned Citizens of St. John. You're about 30 miles away from the little town of Reserve, Louisiana. That's in the center of Cancer Alley. And we've been in existence for 10 years.
Mr. Robert, you have the floor.
Hello? Hi. Okay, got it. My name is Robert Taylor. I'm a founder and executive director of this environmental organization that we call the Concerned Citizens of St. John. And we were founded out of desperation, but we have been working very diligently since our founding in 2016 with the support of a lot of people and other organizations.
Wonderful, thank you so much. And now we'll hear from Kelly.
Thank you. Good afternoon, everyone. I'm Kelly Bergeson with AstraZeneca in Corporate and State Government Affairs. AstraZeneca is a science-led biopharmaceutical company with a significant presence in the U.S., including research and development, manufacturing, and our commitment to sustainability and health equity. I'm really pleased to be part of this panel today to talk about those environmental conditions that are impacting lung health and health overall. And at AstraZeneca, we are committed to and we are embedding sustainability in everything we do, from drug discovery to development and to delivery, so that health outcomes have a lower impact on the environment.
Wonderful. It is, so as I told you, we have a fantastic panel to lead in this discussion, and you are going to be a part of this as well. So I know everybody is having their lunch right now. We're only slightly jealous. But as you're listening, please jot down your questions. We're going to have time for Q&A towards the end of this panel. But you can see that we have people here that care deeply about addressing health disparities. We have people here that care deeply about the health in our communities, and we have people that care deeply about environmental impact and reducing those burdens. So I'm gonna start with a first question for the whole panel. What key environmental factors are facing lung and overall health, whether that's here in St. John the Baptist Parish, or whether that's in Minneapolis or across the nation from your experiences. Can we start with you, Mr. Robert, and then we'll also hear from Tish and then Kelly.
Surely. We are certainly impacted by the industries that are so prevalent in our community with their dispersal of chemicals that's a byproduct of their plant and what the chemicals that they produce. Our air and water is so powerfully and negatively impacted by that.
Live in the center of Cancer Alley. In 2016, EPA held an emergency meeting in our parish and told us that we had the highest risk of cancer in the United States due to emissions of chloroprene from the formerly DuPont facility. They sold their liability to a Japanese company, Dinka, a couple of years before EPA finished their investigation. So they sold their liability. But the fact is, DuPont had started emitting chloroprene in the late 60s. So we were all sick and wondering if it was the petrochemical industry. And that day, that was finite. It is the petrochemical industry. Later that year, we got a report about ethylene oxide, and we also have a facility in Reserve that emits ethylene oxide as well, an Ebonic facility. PM 2.5 is very high, and a lot of different chemicals. My dad calls them a cocktail of poison. So yeah, we have the evidence.
Before we come to you, Kelly, I appreciate these comments, a cocktail of poison. Mm-hmm. Of course, nobody wants a cocktail of poison in their backyard. I find it really interesting that you shared that the community had been thinking that there was something going on connected to the industries and connected to the health of the people that live there. But when the government provided the evidence, that was clear. Can you share a little bit more about the before times where people were making the connections?
Sure. My mom was diagnosed with breast cancer at 60. Later, diagnosed with multiple sclerosis. She suffered in and out of hospitals for 22 years before she passed of congestive heart failure in December of 24. My sister is diagnosed with a very rare autoimmune disease and gastroparesis. So she has infusions every Saturday of her life. A nurse comes and she has an infusion for like 3 hours every week. My brother has kidney disease and now full-blown diabetes. None of those things are in our family or genetic in any way. My grandmother passed away from bone cancer, my uncle from lung cancer, my cousin from lung cancer. That's just my family. That's not the neighborhood across the street who's got 2 generations of different cancers, because both of those chemicals, ethylene oxide and chloroprene, are mutagens. So even if you have some rare genetic thing that may never show up, it'll metastasize it. So if you already have the sickle cell and you live on a fence line, you're more prone to having a worse case of it and not really surviving. One of my classmates lived to be about 24 years old and died from sickle cell. And it's because and everyone on her street has pretty much died from cancer.
My goodness, I know that resonates with many. Thank you for sharing your story. I'm so sorry to hear about the ways that this has impacted you and your family personally, and so many that you know within the community.
It's very real.
It is very real. It is very real. So Kelly, what are the key environmental factors that are impacting lung health and overall health that you're seeing in Minneapolis and beyond?
Well, I'll speak a little bit to Minneapolis, but then I'll come back to Louisiana. So you may be surprised to know that we've had a significant increase or decrease in our air quality, especially in the summer months coming from the Canadian fires. So we've had a much higher incidence of days where normal activity has really been prohibited. And as you might understand, us Minnesotans really like to get out and enjoy the summer months because they're so far infrequent with weather and cold weather. But what I'd like to do is come back to some of the environmental exposures here in Louisiana and really connect those to lung health and health impact overall. So in addition to the petrochemical emissions, we see the poor air quality due to air traffic or due to just traffic. And then also climate factors. So when we think about severe weather, heat, and flooding, and how that relates directly to asthma and COPD, worsening asthma and COPD, increased ER visits, hospitalizations, especially on those days where we have poor air quality, and the high heat indexes. And all of that compounds long-term risks for lung cancer. Additionally, when we think about care disruptions following storms and flooding, we see delays in health imaging, screening, which is so important, and treatment. We also see an increase in mold and dampness that has and aggravates the respiratory disease. And importantly, the access barriers can be amplified when we think about these communities having limited access to specialty care, transportation issues, especially after flooding or severe storms, and that can all impact lower screening rates and delay the detections as well as guideline-directed care. So we heard in the previous session Dr. Applegandi speak about some of the screening rates in Louisiana at 17%. Keep in mind, nationally, we're really at about 21%. So overall, we have a lot of work to do with lung cancer screening. He also mentioned that 75% of Louisianans are diagnosed in stage 4 disease, and that leads to that low overall 5-year survival. So through increasing lung cancer screening, we can detect cancer, the lung cancer earlier. And in stage 1 and stage 2, lung cancer survival can be as long as 60 to 65% for that 5-year survival. So that's why it's really important that we continue to do the work around lung cancer screening, education, and decreasing barriers for that access to care.
What I hear from everyone that has shared thus far is the importance of prevention. On one hand, we're talking about environment, all of the aspects of environment that we've discussed. Industrial activity and beyond are preventable, but at the same time, early detection is also key. And those two work hand in hand. So as I shared, we were going to talk about some of the burdens that our communities are experiencing, how that's showing up through the environment and how that may be connected to our health. Let's talk a little bit about some solutions. So from your unique vantage points, whether you are serving the community in organizing and advocacy, or through the pharmaceutical biopharma space, what are the top 3 things that you think should be prioritized to achieve ideal environmental conditions here in Louisiana and nationwide, particularly as it comes to our lung health? So why don't we go in backwards order, and let's start with Kelly on this one, and then we'll hear from the Taylors.
Thank you. Well, I've already touched on the importance of expanding early detection and prevention, and we just talked a little bit more about this, especially in lung cancer, for lung cancer screening and COPD diagnosis. And really targeting those high burden areas and communities. Also, I think it's really important to strengthen the heat and air quality preparedness so we can help residents with alerts and really to be able to adjust to the outdoor activities and to follow their medication guidance with its respiratory care for inhaler use. And then also providing access for cooling and spaces during extreme events. We're working to really advance policy that provides solutions to removing cost and coverage barriers, and I think there's a lot more that we can do here. And also looking to work closely with advocacy organizations and really creating greater health literacy about the awareness and what we can all be doing. One of the examples that I wanted to share, and something that we've had some good success with AstraZeneca, and really our commitment to access and affordability, is our support program for an offer of a $35 copay for any inhaler that is an AstraZeneca inhaler for respiratory care, and that is for eligible individuals that are on commercial plans, and we're not able to provide manufacturer support for government-sponsored programs, but that's a commitment that we're making, and especially when times of stress from climate exposure, that is a consistent opportunity for patients to take advantage of.
I appreciate the sharing of resources, certainly. How about if we turn to Mr. Robert? In your opinion, what are the top 3 things that you think should be prioritized for ideal environmental conditions, especially those that would protect lung health?
Well, for sure, in my community, we need community involvement, community awareness. Is first thing that I know we really have to struggle for. They are aware of the health impacts they're suffering, but not exactly why and whether or not they can do anything about that particular situation. And then we need their involvement, and we need the involvement of the government and other national organizations that can come in to help us.
Wonderful. So deeply engaged communities through improving awareness, involvement, and government participation. And then Tish, how would you add to this? Three things.
We need real-time fence line air monitoring. We need an alert system, an alarm system. There's alarms that go off at the plant on the site for their employees to take shelter, but there's nothing in the community that warns them when they need to leave. And what's so serious is real-time fence line monitoring happens in California. It happens in Colorado. We have a marathon facility in Louisiana, and it had a fire that burned for 3 days. And the most we got was our parish president saying, Marathon says that nothing dangerous crossed the fence line. Well, that's not enough information when everybody's filling up the emergency room. You understand? So we need to know how to take care of ourselves, how to protect ourselves. So fence line monitoring, we need our government to actually protect us. Louisiana Department of Environmental Quality does not regulate the petrochemical industry. They work for them. So we learned that the hard way when EPA told us this in 2016. They said they should not emit anything more than 0.2 micrograms per cubic meter of air. At that time, they were emitting 400 to 800 micrograms per cubic meter of air. And our EPA, the leader of LDEQ, the director, came to our community and told us they can't make money if they lower their emissions that low. That's what he told us, that we should die because they need to make money. And he did that with the school board when we were trying to protect the students at a school that's in walking distance, like less than 1,200 feet from the facility, a historical school. And he told them the same thing, that they can't make money if they lower their emissions, so we should die. They don't hire us. We are #1 in the United States, our parish, for the petrochemical industry not hiring the people on the fence line. And so that means that we are pretty much probably more than 90% black. And when you walk in that facility, it's probably 80% white. Those people drive into our town, and then they drive out away from the river, away from the poison, with their 6-figure incomes and their, and their retirement plans, and they live a comfortable, safe life. And we don't have the opportunity to even build up our community. So our state is supposed to regulate, and they do not. They defend the petrochemical industry, and now our federal government. That's the next question. But ultimately, we need regulation, and we need to be able to know what's going on, what's coming out of those pipes, and when we should run.
Ooh, I'm digesting what you just shared. I'm sure many are as well. I heard the reactions of people here in the room, and some of those reactions were probably people seeing this within their own communities and also being struck by what you shared. But for the decision makers that are here in the room, I'm just going to repeat the things that each said should be prioritized to achieve ideal environmental health in a way that protects our lungs, and that is looking towards communities that are highly burdened, overburdened, communities that have a high level of cumulative impacts, a number of factors within their community that are contributing, and a number of factors that make us more vulnerable. Specific policy around heat and air quality and guidance on respiratory treatment, and removing barriers that prevent people from being able to seek care early. Community awareness, community involvement, and government involvement. Government involvement has been a theme here, as well as fence line air monitoring, early community alerts as early as workplaces get alerts, if not before, and government action and government regulation that is regulated as expected in communities. And not prioritizing the lives of community members below that of profits and industry. Oh, I think I'm stepping on some toes. I'm going to move on to the next before I get us into some good trouble. So, and we'll start with you, Tish, because you initiated this question. Looking at the current reality of what we're facing in this day, in the current environment with shifts in federal science policy and environmental programs, what impacts are you seeing in your work? And how are you navigating some of these impacts that you're seeing in your work? So how about we start with you, and then we'll hear from Mr. Robert and Kelly.
Oh, that's a loaded question. Okay, so first, we never really had funding from the government before, so environmental justice has been around a long time. So, when we started, we were actually, it was great because the Biden administration came in, and they acknowledged Cancer Alley, and they sent people out here. My dad will talk about his wonderful relationship with our EPA administrator. But ultimately, it was what we expected to the nth power, though. You can kind of brace yourself because our state is a very conservative red state. We already know the legislation works against us. We already know all of these facts. But when it actually happens, you're like, God, they had another chance to be decent human beings, and they just can't do it. They can't do it. It's just not, it's not natural for them. And so they reversed everything that the Biden administration did. We actually, and more. They're removing science. They eliminate everything that affects the quality of life for fence-line communities with the swipe of a pen, and then we have to survive. So what we do is we keep moving. We are trying to educate our community and trying to get them to come together because they've actually been fooled in believing that the petrochemical industry is their friend. There is a tax break. It's called ITEP, Industrial Tax Exemption Program. And so when we talk about tax incentives, these petrochemical industries have been in our community for almost 60 years, and they pay 30% of their property taxes. Those property taxes go to our schools, to our parish for infrastructure, and to our sheriff. And our schools are failing. Our infrastructure on the fence line, we're still having just extreme weather flooding in homes in our communities along the fence line. So we don't benefit from any of this. But the petrochemical industry gets to poison us without regulation. What they do is they give away stuff. So they have a great campaign. They got the money, so what happens is instead of the school being one of the wealthiest in the country, because we have all of these plants making billions of dollars, right before school starts in July, there's going to be a giveaway. And so parents line up for miles along the highway to get a book bag of school supplies with the petrochemical industry stamp on it. They're your friend. It makes my dad go crazy because he's like, we are not beggars. We work hard for everything we got, and you making us beggars. You know, we work hard. We built this. And also, Thanksgiving, they're giving away groceries. And Christmas, they're giving away those wonderful plastic toys because the petrochemical industry is into plastic business. So we have to understand that plastics is a major part of it now. And all of us are here turning into plastic as we speak. So they have our community believing that they're good to us. And the jobs that are created are pretty much from contractors coming in and servicing the facility. So we'll still get the jobs, but not the six-figure jobs, not the best insurance, not the best of anything, but we get the disease. So it's unreal.
There are so many soapboxes I could stand on for all of the things that you just said. That's a month-long course of everything that you just said.
Yeah.
I just wanted to elevate the comment of, we didn't have anything prior to the previous administration.
Yeah.
Our communities are so amazingly resilient. We've been making a way out of no way for generations. That doesn't mean that that's right, but that also means we can continue to tap into our strength, especially in a time such as this.
But we need to build it
But we got to build it.
together.
We got to build it, and we have to build it together.
Yes.
So to add to that, are there experiences also that you have to share, Mr. Robert, about these shifts in federal science and federal science policy and how that is impacting concerned citizens of St. John?
I'm having a problem here.
Yes, and I might not be holding the mic close enough. So same question that your daughter just answered as well. Are there impacts to the concerned citizens of St. John that you have felt as it relates to the recent changes in federal science policy and environmental programs through the government? How are you affected, and how do we continue to move forward?
Well, we're certainly terribly impacted by the changes that are taking place. As Tish alluded to, the Biden administration came in to help us. That was our first help that we got after we started this fight in 2016. It wasn't until then. And Mr. Reagan actually came to our community himself. He called me personally. I was blown away. We marched. We'd actually marched from Fifth Ward to Baton Rouge, trying to get the attention of not only our local government, but the state and federal government. We marched twice, 50 miles, no responses. All of a sudden, I get a phone call from the administrator. He came to our little poor neighborhood, walked the streets. He initiated programs to me that was a blessing, that Hahn ruling, the fact that the EPA was now going to have the ability to enforce their rulings. That was miraculous. I mean, here now we finally have a chance. And then along come Trump. And they've reversed all of that now. They dropped the lawsuits. He did away with the Hahn ruling effectively anyway. And so now we're back at it again. We have to now come forward and fight this more vigorously than we did before. And fortunately, we've found people who are working with us and who are willing to help us to sustain our efforts and to even become more vociferous and actually not just to actually get into action and to do things and to awaken our community, especially. My appeal is going out that we come together now and stick together to fight this problem.
Some of what you shared I found extremely inspirational. Thinking about that your community had outcried for so long, and the administrator of the United States Environmental Protection Agency, or the EPA, came, and there were resources delivered. In the time that Michael Regan was EPA administrator, as far as I know, EPA prioritized disadvantaged communities overwhelmingly. The Biden-Harris administration set a goal that 40% of resources would benefit disadvantaged communities as it pertained to environmental activities. But Michael Regan and the EPA upped that goal, and 100% of those resources benefited disadvantaged communities. And it's amazing to see how you were able to utilize that and transform communities. And I look forward to the opportunity that will ensue in the future to continue that work. And in the meantime, we continue to make ways out of no way. And so, Kelly, same question. With these changes, how are you seeing these changes in the biopharma industry? How are you navigating? How are you keeping this work going?
Thank you. We are seeing changes in environmental as well as monitoring of climate resilience programs. And importantly, we're really also following and tracking any changes that could be made to the preventive service coverage and programs there. So the United States Preventive Services Task Force, their recommendations for eligible patients for lung cancer screening and other screenings really important because most of the insurer plans follow what those guidelines recommend. So we want to ensure that those coverage protections remain, and that may be a place where some of the states may have to step in and further codify or provide additional policies in the states to make sure that patients receive the screening at no cost. And then we're also looking for where we can make improvements or advance that further for additional policies that would protect patients. So our approach is really to stay anchored in science and evidence and really those programs that I've described around prevention, early detection, really ensuring that patients have access to affordable medications and that despite any of the policy changes that might happen from a federal level. Today probably isn't the day to talk a lot about some of the Medicaid concerns, but I think that is something from a state perspective we're really going to be challenged with to implement the changes from a federal perspective and what that might mean to the local policy changes or how those would be funded through cutbacks in other areas that are really needed.
I love how you shared this multifaceted way of, on the one hand, looking at the drivers that are contributing to health outcomes, and then also looking at what those barriers are that might be further preventing people from identifying what is going on with their health and being able to do something about it early because that early action is key. So we are going to open for audience questions. I'm saying that to warm folks up. I have one more question I want to pose to our panel, and we would love to hear some questions and comments from you here in the audience right after this question. So, and this is a big picture question that's about these times. How do we meet this moment? In other words, how can we collectively remain resilient and continue advancing progress on environmental conditions that impact health during times like these? And we'll start with Kelly, and then we'll hear from our concerned citizens of St. John.
So we've talked throughout this discussion or shared the importance of integrating climate action, health equity, and really community partnerships. So that's something that our systems and organizations can continue to do. And then as individuals, it's really taking control of our own health, ensuring that we understand the air quality index here in Louisiana, and that you're continuing to follow through with those screenings and the care that is planned for you with your physician. So following those care pathways. Educate, don't hesitate. So monitor your environment and take the appropriate actions to ensure that you're prioritizing your own health.
Yes,
Okay.
Mr. Robert.
I certainly agree with that. And the importance of our, I want to reiterate that, of involving our community. And it's so important right now, especially to where we are in our fight in St. John, is involving our community and getting community involvement so that we can hold our politicians accountable for helping us to protect ourselves.
Okay. Well, first I want to say that St. John the Baptist Parish had the highest death rate of COVID in the United States in March and April of 2020. And that's not a surprise to us because our immune systems are compromised. So while we were watching our families die, every day somebody was calling and saying, all 3 of them, the whole family died from COVID. We have to understand as a community that we are at a higher risk of these things. And it is so important for us to just get them to join and to understand that these people are the cause of this. It is not because of what we eat. It's not because we live in Louisiana and we eat that pork chop or that spicy food because, well, we didn't do that in my house. So you can't blanket something as devastating as our little parish being number 1 in the United States. But if you got the highest risk of cancer with the worst emissions, it seems only natural that we would have upper respiratory issues. And from generation to generation, we've seen the asthma. My children, all of my siblings' generation, our children had asthma and eczema. Now my grandson was born and he's autistic, which is showing up very common right now, autism. He was born, of course, premature. And of course, he's got little eczema patches, and he constantly has upper respiratory infections. It's not going away. It's generational. So we have to teach our community that if we come together and we need to create better people to represent us. So we need to nurture the next generation of politicians that's not going to be, honestly, purchased by the petrochemical industry. And we need to make sure that they understand that the decisions that they make affects their whole family as well. And we're going to fight until we can't. So this is not going to stop. We have generations to come, and they need to be healthy.
I think those are beautiful words to end on and deserve a round of applause. Yes. Our community deserves to be healthy. So with that, we're going to open for Q&A, and I believe there is somebody that is going to come around with a mic. If not, I will come around with a mic. Okay, perfect. Thank you so much.
I'm sorry. I've got to look at her when I'm talking. I was diagnosed in March of 2014 with stage 4 non-small cell lung cancer. It's rare. But I know that when I was hospitalized, a nurse said, first of all, thank everybody up there. This conversation really triggered something in me because I've been so focused on surviving, and I'm almost about to cry, that I didn't want to think about my environment. But a nurse said, do you live near a nuclear power plant? I'm in the middle of a conversation with ChatGPT right now. Don't judge me. But I started plugging in my address at that time. I lived there for 14 years, and I taught there. And that was my first home. But it bothers me to know that I'm not the only one who was diagnosed with cancer. Now I start to remember some neighbors who had cancer. Is it possible that that nuclear power plant that was 10 miles from me, I would watch them move tanks and stuff on my road that I lived on, Blue Star Highway, to that power plant? What could it have been? Anything associated with nuclear power plant? I know my cancer diagnosis is rare. They always say environment, it's based on the environment, so nobody wants to take a stab at it. I just want to know before I die, but I'm not going to die today. Okay?
We got work to do, baby. We have work to do. It is very common that we have rare diseases, which means that there's not a cluster to show up. So in my community, on my street, there's probably about 75 homes. We had 3 people on my street that had brain cancer. But 3 in one parish, I don't know if there's more. But the fact is, my sister has very rare autoimmune disease. People are diagnosed with rare, every type of, across the spectrum. And our doctors, they see this, but we cannot get our doctors to even say directly that that's what it is, because they're afraid. If we needed one study, and well, we just received one, the CODA study, with in partnership with Dillard, and what they did was something that we've been asking for forever. They use Medicaid information, so that's government information, and they use EPA and LDEQ's environmental emissions information. They came to our community and asked us what were we most concerned about, so that they could look for specific areas to do research on. And of course, the compilation just confirmed everything once again, that the closer you are to a petrochemical industry, the higher rates, 20% or more higher rates of different diseases you're gonna have. What we were shocked at was behavioral decisions, because our children are constantly diagnosed with ADHD, and that affects them. There's a greater diagnosis, because now we're not talking about risk anymore. We're talking about diagnosis, because that's Medicaid. So if we had that from Medicare, from just the hospital, according to census tracts, it would blow everything out the water. And of course, so that means that stuff is we're not privy to that. And so what we needed was for the medical profession to actually say, you live close to here, and this is all of the information that I see in my clinic for the people in that area, and that something needs to happen. And we don't have that, unfortunately. But rare is a problem, because it doesn't show up as much.
Oh, I so appreciate your comment. I so appreciate your response. And Kelly, did I see you preparing to respond as well? I'll save my comments. Go ahead, please.
First, I would just want to say thank you for sharing your story and continued success with your survivorship. And I would encourage, if you have not done so, to have your biomarkers tested through the tumor, so the tumor biomarkers. Well, wonderful. It's a really good example of seeking that type of treatment in clinical trial participation, so continued good success.
Thank you so much. Thank you for raising these questions. I think we have time for 1 or 2 more questions. I see a hand that was raised here, and I see one hand over there.
Hi. Thank you, everyone, for being here. Similar to the point that Sharice made, I am an 11-year lung cancer survivor living with an upper left lobectomy. And I hear us having conversations about holding perhaps manufacturers of dangerous chemicals and products accountable. However, lung cancer screening guidelines are linked to a behavior. And similarly, those diagnosed with lung cancer, we look at that one behavior, which is smoking, to say whether or not that's linked to their cancer. And this may be an obvious question, but why aren't we holding those manufacturers of those tobacco manufacturers accountable? That would erase a lot of the problems, and perhaps a lot of economic things would fail, but why aren't we holding them accountable?
Now, that's a heavy question, and I welcome any panelists to hop in. But what I will say is that for all things where we are challenging entities far larger than ourselves that have advocacy that is quite impactful, It's a fight and it's a challenge. I had the privilege of having a tour of the CDC labs in Atlanta, Centers for Disease Control and Prevention labs in Atlanta. And they shared about the major milestone of getting the warning label on cigarettes. It took 20 years for that to happen, with there being very active evidence of those links between cigarette smoke and cancer. And it took 20 years for that warning label to come onto the package. It can be quite the fight, as you were pointing out here. And I welcome any panelists to add any further.
There have been some large tobacco settlements. I can't speak to Louisiana, but that's something that you may or we may check into further here and see how those funds are being appropriated. And maybe those funds could be appropriated to more cessation resources, education. Louisiana has one of the lowest taxes on tobacco products. That could be another avenue to discourage smoking and then use that tax as resources for continuing education and smoking cessation resources.
Very much appreciate that, Kelly. And I think there's one last question over here, and then we can, okay, I am told that we cannot take this last question. Hopefully our panelists will be able to stick around and you can ask questions of them one-on-one. I want to thank all of you for this amazing opportunity to raise this conversation in this space. Please join me in thanking Ms. Tish Taylor, Mr. Robert Taylor, and Ms. Kelly Bergson for sharing their expertise today.
Thank you.
Thank you so much to the team here of the HEAL Collaborative that made this possible. There are so many people in HEAL to thank, but certainly those that we saw directly hands-on this, Shanika, Shayla, Vicky, James, and all of the HEAL conference organizers. We're so grateful. And thank you to you here in the audience today. You all are heroes. You all are patients, you're survivors, you're providers, you're caregivers, and you're also inspiring. So thank you so much. And with that, I'm gonna pass it back to our organizers.
Well, can I make a shameless plug? Okay. Concerned Citizens of St. John, we started a podcast. It's called The Good Neighbor Podcast. It's on YouTube. Our YouTube channel is Concerned Citizens of St. John. If you want to know any information about us, if you want to reach us, we are a 501c3, so please donate. Remember, it's tax deductible. We'll send you your little paperwork to get your money back, but we'd appreciate anything that you could do to help us.